In this video, we are going to be looking at the topic electroencephalography. Hi, I'm Sharon. I'm working as an associate professor at M College of Nursing. The following are the objectives that we'll be addressing in this video. EEG is a non-invasive test used to record the electrical activity or rhythm of the brain. It helps us understand brain function by detecting electrical impulses produced by neurons. This was introduced first by Hans Berger in 1929. Let's look at the principle behind EEG. The brain's nerve cells, that is, the neurons, communicate using electrical signals. EEG detects these signals through electrodes placed on the scalp. These signals are then recorded as wave patterns. Let's look at the indications. This helps in diagnosing epilepsy and seizure disorders, and in sleep studies to assess insomnia as well as narcolepsy, to detect encephalopathy or any brain dysfunction, to monitor brain activity during surgery or in ICU, and to support diagnosis of brain death. There are no absolute contraindications in EEG, but there are a few relative ones. Let's look at them. Open scalp wounds or recent scalp surgery. Here, the placement of electrodes may cause pain, infection risk, or interfere with wound healing. The next is severe scalp infections or dermatological conditions such as extensive dermatitis, burns, or active skin infections can make the electrode application unsafe or uncomfortable. The next is uncooperative or severely agitated patients where excessive movement can compromise recording quality, and sedation may be required in selected cases, especially in pediatrics. The next is photosensitive epilepsy. This is during activation procedures where intermittent photic stimulation can provoke seizures. Hence, it should be performed with caution and medical supervision. In those who have hyperventilation, especially with severe cardiopulmonary disease, this may precipitate dizziness, syncope, or cardiorespiratory distress. And for those who had recent trauma with unstable condition, it's best to postpone the EEG until the patient is clinically stabilized. Let's look at the procedure. In preparation, the patient is seated or lying comfortably, and the scalp has to be cleaned and the electrodes are applied. Hence, the patient is asked to take hair wash the previous day and have a dry, clean scalp. For the recording, the patient is asked to relax, sometimes given stimuli like flashing lights, or the patient is asked to sleep. The time duration is usually 20 to 40 minutes, and it is longer in sleep studies such as polysomnography. The output is the brain waves are displayed on a computer screen as curves. Here you can see how the electrodes are placed on the scalp for easy measurement. Let's look at the types of brain waves that are assessed in EEG. The delta wave, the hertz is 1 to 4. The mental state will be deep sleep, and the recording shows a slow wave. Theta wave is 4 to 8 hertz, shows drowsy mental state, and you can see the variation in the wave. The third one, alpha wave, 8 to 12 hertz. Here the patient is in a relaxed, awake state, and you can see the variations in the waves. And beta wave, the speed is 12 to 30 hertz, and here the patient is focused, active thinking, and the patient is alert. So all this measurement is taken over a duration of 1 second, and you can see how the waves range from slow to fast, from delta to beta. Let's look at the advantages. EEG is a safe, painless, and non-invasive procedure. It provides real-time brain activity. This is useful in both diagnosis as well as research. The limitations of EEG are poor spatial resolution. That is, it cannot pinpoint which exact brain structure has the issue. And it is sensitive to artifacts. That is, eye blinking and muscle movements can cause variation in the waves. And this needs correlation with other investigations to diagnose a condition, such as MRI, CT, PSG, etc. Let's look at the role of the nurse in EEG. The nurse has to prepare and explain the procedure to the patient, ensure that the patient's scalp is clean and electrodes are applied properly, support the patient during the test, especially children, as they may be scared and worried, observe and record patient behavior during the test, and to provide post-procedure care and documentation. The following are the references. Thank you for your patient listening.